If you've just joined, please put your name, where you work, and what you do there. It's nice to see a lot of familiar names. Thank you. Well, I'd like to welcome everyone to this call today. This is our regional COVID-19 virtual open forum. My name is Janelle Shear, and I'm from Superior Health Quality Alliance. This is our second regional call with 3 states of Minnesota, Michigan, and Wisconsin. The purpose of our call today is we know how COVID-19 has become a top priority for everyone in healthcare as you're preparing and as you're actually dealing with patients with the COVID-19. And so the purpose is to have a cross-setting networking open forum. We know that our departments of health are doing a wonderful job in having calls with different provider settings, but we were asked to form a sharing call between the settings. And so that's the purpose of the call. It's for you to ask your questions and then share what you're doing with each other. So the forum is where you have opportunities to put your questions in chat or on the phone. So I want to tell you just a little bit about Superior Health Quality Alliance first. It is a fairly new company. We were formed in 2018 across 6 states, although today on the call it's 3 states, Michigan, Wisconsin, and Minnesota. The purpose is that we want to achieve the broad aims for the CMS quality. And our goal is to improve quality of health and healthcare for consumers, patients, clinicians, organizations, and the communities that we serve. So I'd like to talk a little bit about some housekeeping things. All sessions are recorded. So if you missed a call that you registered for, we will be sending the link to the recording. We do like to know who's on the call. I saw for the registration list that there were quite a few people from all different settings across the continuum. But if you would just put your name, your state, your organization in the chat box, and you can go ahead and keep doing that as I'm talking. We ask that you mute yourself when you're not speaking, and then remember to unmute yourself and state your name, your state, and your organization. So to mute yourself, if you look on your screen, there's a mute button, either a microphone or a phone. Just click on that, and then to unmute, click it again. If you're on the phone, press *6, and that will unmute you. We ask that you don't disclose any personal health information, so no names of patients or anything that would qualify for PHI on the calls today. If you're having trouble with Zoom, this platform, you can message Superior Health using the chat box. And then if you have questions or comments in the chat, we'd like everybody to see them. So there's a choice where you can click everyone, and please do that. Okay, so now we'll open it up for your questions and comments. And you can either verbally ask questions or you can put it in the chat. And our chat monitor is Elena Smith. Elena, would you just give a wave? Thank you. And while we're waiting for the first question, I'll just let you know that, so we had our first regional call last Thursday with all 3 states. And afterwards, we compiled the notes in a kind of question-answer format. So the questions, it's in a table of questions on the right, the answers are on the left, and the answers are from you. So they include resources and what you're doing for addressing the different questions. And then we also compiled a resource list based on the information that were given on the last call. So that in the invite for this, when you registered, if you saw a link that listed the recording and both of these resources, that will be the format that we will be sharing those with you going forward. And I see people are still putting their names and organizations in the chat, so thanks so much for doing that. All right, so we'll open it up now for time of questions and comments, what your concerns are, what things you're struggling with, or if you've had a tip or something that's really been successful for your organization, we'd love to hear about it. And I think as a facilitator, it's always the hard part of staying quiet. So I am going to start out by asking a question. I know we've had people talk about, well, how do you communicate? Say you're at the hospital, and how do you communicate with your post-acute, so like the nursing home health agencies that you work with? And I'd like to call on Gloria Ray from the Henry Ford Health System in Michigan, as they've developed a strategy that they've been using in their healthcare organization. So Gloria, I saw that you put your name on, so if you can unmute your lines and just share with us what you're doing.
Good morning, everyone. My name is Gloria Ray. I'm the Director for Post-Acute Care for Henry Ford Health System. As the pandemic has continued, we've been trying to reach out to our community members as well as SNF members. I'm sorry, can you hear me?
You did cut out there just a second.
Oh, okay, I apologize. So we did develop morning meetings, and they're just morning huddles for our community members as well as our SNF members. They are two separate meetings. They run at 8:30 and 9:15. They do overview our system operations. So we go through each of our hospital systems and indicate where our surges lie and where our capabilities are, in order to be able to make sure we are being transparent with the community in regards to the things that we are able to offer at that time, and just so that they know where we need to be able to disposition patients to as well. Similarly, for the community members, we do the same organizational structure overview, and then we are able to address any system overviews or questions and concerns that they may have brought up the day before. And are continuing to work through all the different issues that are coming up secondary to the pandemic through this way. We've been able to develop new systems for identifying COVID positive patients and making sure we're notifying our SNF facilities through CarePort, and these are all updated through these morning meetings. We've also created a newsletter that is distributed every Friday with any resources that we have found or any additional resources that Henry Ford Health System may be providing, and then addressing any of the issues or concerns that have been brought up throughout that week. If we've found any resolution to those, they are added to the newsletter, and the newsletter is distributed just in the invites of the participants that are in the morning call, to try and limit everybody's email congestion, which we know has been significant in the last couple of weeks.
Great. So Gloria, I have a couple of questions for you, and others may as well. You can chat them in or speak them. So my question is, tell me a little more, give us a little more details on the call you have with your post-acute providers. So is that a phone call or a conference call or a video call, or how did you know who to invite, and what type of folks are participating on those?
We originally started the conference calls for the SNFs in regards to SNFs that were sending high volume of patients to certain hospitals. And so in this conference call, and it's either a call-in line, or you can call in through, it's through a Skype line. So it could be either
Sure.
conference or voice. I don't have anybody really participating with video at this time, but originally started with each individual hospital having their own independent calls, and then the SNF facilities surrounding that facility would call into those individual calls. We found that that was becoming incredibly time consuming, and some facilities or larger corporations had to call into multiple calls as well. And so that's why we standardized it to one call for the whole system. And originally it started with those facilities in the area that had high volume into our SNFs, but it's gradually expanded from that. And I invite anybody who's interested or who wants to be able to participate or have that greater community sense into those calls. And so I'm not necessarily restrictive as to who's calling into those meetings. Now the roll call, there are specific facilities that I'm calling out and asking specific information from after the hospital operations piece is done. And so we are asking for them to tell us what the volume of COVID positive and pending patients in their facilities are, if they're having PPE or staffing issues, so that we can be aware of why they're not admitting patients, and their capability of accepting. And so we are monitoring if they are able to accept COVID positive patients, as well as if they are not, what are their criteria for accepting new or returning patients, if they have to have a negative test, or if they will take asymptomatic patients without negative testing, and any further criteria they may need for that. And then they can also disclose any additional information or barriers they may be having to the community, so that we can discuss as a whole.
Great, thank you. And just to help us that aren't quite so familiar with your health system, how many hospitals are in the system that are a part of this?
We have a total of 5. However, we have 4 participating. Our 5th hospital is in Jackson, and so they have their own surrounding facilities that I think that they're doing similar calls with those 7. But the other 4 that we have are Henry Ford Macomb, Henry Ford Wyandotte, Henry Ford Maine, and Henry Ford West Bloomfield.
Okay, great. Thank you so much. Now, I'd like to open it up for others if there are questions for Gloria, since we're on the topic of the huddles. Anything, Elena, that has come in through the chat specifically for Gloria at this time?
I'm not seeing anything specifically for Gloria. We do have a couple other questions, but give everyone a couple seconds. Just as a reminder, if you do want to speak up over the phone, feel free to unmute yourself by clicking on the microphone or the phone on the Zoom platform, or if you're calling in by phone, press *6 to unmute yourself.
I'll just ask, oh, I'm sorry, go ahead.
Go ahead. No, you go ahead.
I was just going to ask, are there others on the call that have a similar approach, or maybe doing something a little bit different, but connecting across the healthcare setting with the folks that you work with, the organizations that you, transfer patients back and forth to? Is anybody else doing something like this, or a different way of doing it? Okay, well, thanks so much, Gloria. We really appreciate you sharing what you're doing, and know that you are kind of in the thick of it now. And so our thoughts are with you and everybody else on the call here too.
Thank you.
Janelle, we do have one question in the chat that I might ask this person to unmute themselves and kind of give us a little bit more information. Michael Mithen asked, are there any assisted living or AFCs taking patients with COVID-19? We probably need a little bit more information. We do have 3 states on the call right now. So if you are able to unmute yourself and kind of provide a little bit more information, we might be able to maybe help answer that question. All right.
Janelle, this is Jane. I was just looking in chat as well, and while you're waiting for the other person to get on, there was someone who asked about, working in healthcare. How do we come and go from our homes, basically, in a safe way? And I don't know that I've seen. I was just looking at somebody shared the CDC one, which has a lot of good information about just the things that we can do in our home. Which is really helpful and just in general. But I have not seen anything that's specifically for healthcare folks as we come and go. I can tell you what kind of the standard practice has been in our house and in a number of my colleagues is oftentimes just wearing a set of clothes to work, but then changing into scrubs at work. So you're changing, you're not wearing the same clothes home that you wore at work. You're finding a place to change into something clean, clean shoes, clean clothes, and wearing that into your home. Then scrubbing up when you get home. My husband's an intensivist, and so he will leave scrubs at the hospital, take a clean set of scrubs. I don't exactly know where he changes, but finding some place that is kind of out of the patient care area to change into something clean, clean shoes, brings that home, and then washes those. So, and then following the other things at home. So that's one, I think it is a challenge to find that space. That's kind of the path that a lot of my colleagues have been doing. Just to have that like set of scrubs or something that you can wear in that in-between time.
Thank you, Jane. And just to introduce Jane to everyone, Jane Peterson is the medical director for one of the QIOs in the Superior Health. She happens to be from Minnesota and is a practicing physician in long-term care. So Jane is available for questions to that as well.
We did hear back from Michael in the chat. He did mention he couldn't unmute. He is in Oakland County, Michigan, and contacted over 80 communities this week, and less than 5% were taking new admits and 0% were taking COVID positive. So if there are any of those facilities on in the Oakland County, Michigan area, and you want to speak up if you know of anyone, please let us know.
This is Gloria. Just from the community calls that I've had, I would secondary what he said. There are a majority of facilities are taking back their own patients, but not accepting any new patients. And a lot of it has to do to the PPE that they have available, as well as their staffing. So there are not a lot of community resources or AFC or memory care units that are taking new patients. Most of them will accept their own return patients, though.
Thank you.
And Cindy in the chat just wanted to echo a little bit of what Dr. Peterson mentioned. Her hospital ordered 500 sets of scrubs for employees to change into at work, and those are being laundered by the facility. So it's a nice thing. We do have another question in the chat. Do we have any representation from the EMS community to hear about your specific challenges?
And then I see there's something in the chat where somebody was asking for a fact sheet for family protection from exposure. And Barb, thank you for adding that resource there. And any resources that are put in the chat, they will be put on the resource list or in the notes that will be available for you after the call. So don't feel like you have to, like your only chance to grab them is right now.
We do have a couple other comments or questions in the chat. Teresa Sly asked, I'm an activities director. Is it advisable for my aides to be entering rooms and interacting with residents, or are we considered non-essential personnel at this time? And if you would like to speak up, you can press *6 on your phone to unmute, or if you're on the Zoom platform, you can click on the microphone or phone and click on mute there.
While people are gathering their thoughts, this is Jane. It is a tough question because you're kind of balancing the social isolation with limiting the number of people just going in and out. From a infection control prevention, my answer would be, I think we have to literally count how many ins and outs that we have from people's room and limit them to only those that are absolutely necessary for the basic cares of that person. So I wouldn't want to call activities non-essential because I think they are essential, but in this situation, I would have to suggest that not having people going in and out of residence rooms would be the most prudent thing to do. You know, even in from the clinical standpoint, we're spending a lot of time looking at which of our residents, you know, we can take off of Coumadin and put them on something that doesn't require lab testing, because that it limits one less person going in to collect blood, doing things like that. So we really do, you know, that doorway to that person's room should be breached as few times as possible during the day, and kind of breach, maybe not the right word, but and with the least number of different people each day.
This is
Hi,
Gloria.
my name is Samantha.
Sorry. I have a really quick addition to that.
I'm in Wayne County, Michigan, and I'm also an activities director and recreation therapist. And right now, at least my building, they don't have any regulations on the activity aids going in and out of the room, because right now all we're doing is providing one-on-one activities. So they want us to go and do one-on-one activities in their rooms. So I don't know I know that you guys just mentioned something about that, but I know, like, right now our administrators want us visiting the residents as much as we can, just because they are laying in bed staring at the wall or staring at their TV, and they need those purposeful things to kind of break up their day and make sure they're not getting worse and declining by just sitting in their bed all day and not doing anything of purpose.
Yeah.
This is Gloria. Additionally, there's been a lot of facilities using FaceTime and Skype and a variety of different methods to still communicate and have like that face-to-face without having to enter the room communication with the patients. And they've been encouraging that for family and friend communication as well, just to keep the patients interactive. But they are limiting, at least in our area, they are limiting the amount of people going into rooms. But that could be another idea that people have, is if patients have their own cell phones, trying to be able to do that communication through there.
Gloria, are residents using their cell phones to communicate with staff, or is it mostly just family?
They can use it for both, from what I understand. Staff is also trying to, they are really trying, because staffing is so short and PPE is so short, they're really trying to come up with alternative ways to be able to still communicate and engage patients within their facilities. And so being able to use technology, whether it be placing iPads in the room and being able to talk to them through their iPads and have that face-to-face contact instead of just being able to call over a speaker, is really what a lot of facilities have been trying to look at, especially for those facilities that are taking COVID positive patients and having to place them in isolation. It can become difficult for the patient. And so they're just looking for a variety of different alternatives to keep them engaged.
Great, thank you.
We do have a couple extra comments in the chat kind of about these questions. So In the interest of preserving PPE, many organizations are allowing only clinical personnel in resident rooms. Someone else said our activity staff is helping by contacting family members. We have zero visitation and assisting residents with calling family on FaceTime. Go ahead. I know Samantha made another comment in the chat. They delegated our activity staff to assisting residents to video chat with their family. A lot of our residents are low functioning and need that assistance.
Hey, Janelle, this is Bill Santerre with Superior Health. I want to go back to that EMS question. I am working with several rural EMS collaboratives in northern Minnesota and southern Minnesota, and a couple of things that I've been hearing the last month is a huge concern about having adequate supplies on hand with the small rural EMS teams, and then secondly, have their staff fully trained on all the procedures. And again, we're talking small rural communities where a lot of them are volunteers that they are expected to be trained and follow the proper procedures. So training and supplies are in rural communities is a big concern with the EMS teams.
Thanks, Bill. And if we have anybody from EMS on the call, we'd appreciate hearing from you as well. And I see we're getting quite a few different things in the chat.
Yeah, there's some conversation going back and forth a little bit. Again, as far as activities goes, is it up to the discretion of the family as to whether activities will continue to do one-on-one interactions, or are there specific CDC recommendations? And Samantha let them know, I believe it is up to the discretion of the facility. I know some places are not doing any activities, but we are doing only one-on-one. You know, there's another question within the chat right now. This comes from Katie Trombley. The guidance regarding healthcare workers wearing homemade masks over a surgical mask seems to keep changing. What's your opinion about them? Is there benefit?
Jane, I'm wondering if you would be comfortable speaking to that?
I would agree. There's a lot of different, the guidance on masks is kind of a fast moving piece. The real reason for, the homemade masks over the other masks or surgical masks over other masks is just to preserve the things like the N95s, which is usually the mask that's underneath. One of the things, I was actually just on a call this morning, and even the homemade mask patterns are getting modified now. The new recommendation is to make the homemade mask with a slit in the top, because what they're finding is you can take the HEPA filters off of vacuum cleaner bags and put inside the homemade masks, and it actually bumps their effectiveness up quite high. And so I'm going to have to say it's going to be just kind of a ever-changing story. I think the real thing is we're going to have to preserve as much as possible that disposable PPE, because we're going to need it. And so anytime that you can avoid throwing away a mask, do it. Try to figure out another option. The surgical masks over the N95s or the homemade masks are all viable options right now.
Okay. Thank you, Jane. Appreciate it. And I see we are down to like 1 more minute. So if there are some last questions you have, go ahead and put it in the chat and we'll just keep track of it. The other thing is, this is an open forum, so whatever is discussed, we want to meet your needs for the networking. So if you would just put a little comment on how you feel this is meeting your needs, or if you have suggestions on how we can improve these calls. We plan on doing them through April, and then we'll reassess to see if the need is still there. So these will be every half hour or a half hour once a week on Thursday, 9 Central, 10 Eastern Time. And if you're on the call today, you will receive the invite for the next call.
And there was one chat that was just posted that I think can kind of leave us on a nice note from Chris Van Heeren. There is a facility in the Madison area that is using their Facebook page to post short videos with permission of their residents. My favorite is a man who likes to tell jokes. The families get to see their loved one, and it makes for good conversation / virtual celebrity status. Thank you for that.
Yeah, thank you so much. So I'm going to close the call today. I just want to say thank you to everybody, and we appreciate the work that you're doing in your communities with the patients. And please be safe. Thank you.